So my name's Jay Bell. I'm from Iowa, grew up 45 minutes from where I go to college. I'm an industrial engineering student. I'm a sophomore. So a lot of my time is spent making things more efficient in school, but I've always had a passion for service and helping others. Um, I'm really excited to continue to use the skills that I built over this fellowship, and I'm really grateful for all the opportunities it's opened for me. My main takeaway is that many different people are good at very different things, and what you're good at is not necessarily going to fit into one category. But what can be really helpful is if you can give your specialty skill towards a greater goal. So we have this great mission here, and someone in research might not have the same skills as someone who goes out and presents to an audience of 500 potential donors, but both people are equally valuable, and it's all about finding what you're good at to contribute the most. So I was really happy to try to find that in this group.
Hi, my name is Zainab Zafar. I'm a junior at the Whaley High School in Long Island, New York. And I feel like what really made me gravitate toward this internship is the humanities field of it, an aspect of it, and how impactful it has been to underrepresented minority groups and communities. And while I first started, it felt very daunting to me because I was just younger than everyone else, and I didn't know much about insurance or the medical field or certain policies because the educational system doesn't really talk about it and teach students about it. But I feel like throughout it, my peers have helped me. All the fellows have been really helpful and guided me throughout the process, and learning about how easy it is to fall into medical debt and ways in which we can prevent it will prevent ourselves from falling into medical debt has will eventually help me in the future. But also before even starting this internship, I was a campaign president for specifically RFP medical debt before it became Undue Medical Debt. And I was able to relieve money through talking to friends, families, and posting it on social media, but I didn't really know the root causes and the systematic issues within the healthcare field. So I feel like learning more about that has helped me become more confident because I will be continuing my campaigns. Um, it has helped me become more confident in what I'm talking about and incorporating and getting others involved as well. So it's been very beneficial in that aspect. Claire, you want to go?
Yeah, thank you. My name is Claire Kajemko, and I'm a sophomore at UC Berkeley studying public health, the minor in public policy on the pre-law track. And I would say one of the major things I took away is not just learning about something that I wasn't very familiar with, but being able to connect with my peers for the fellowship, but also talk to a lot of my friends and kind of tell them about this issue, because I think I realized that the problem about the youth kind of being unaware about medical debt and how to prepare themselves for the future was a lot more widespread than I imagined. And so this fellowship has really allowed me to connect with my community and my peers and create a way forward to continue the message in the future as well. And I'll pass it to Michael.
Hey, how you doing? I'm Mike Rosenbaum. I'm an accounting student at Colorado State. And my main takeaway of the program is I got to meet so many great people, so many dedicated people, either within the fellowship or within this company. That was really wonderful to connect. And Dina did such a great job running this. It was very smooth. So thank you guys. I'll pass it to Galila.
Hi, everyone. My name is Galila, and I'm a student at UT Dallas studying neuroscience on the pre-med track. And basically, throughout this whole experience, really Undue has kind of shown me or like pushed me to think beyond just medicine as like a treatment and recognize the financial barriers that determine whether someone can even get the healthcare that they need. And so learning about how policy, advocacy, and like community action can erase these burdens for people, because at the end of the day, like it's not just numbers on a bill, like it's actual weight that people carry with them every day. And so being a part of this program didn't just like educate me, it really gave me a sense of purpose and to continue fighting for healthcare equity, which is something that I want to do as someone wanting to pursue medicine. I'll pass it to Tripra.
Hi, my name's Tripra. I am a junior at UT Dallas in the Dallas area. The reason why I joined the program was I recently went on a medical mission trip, and then I just saw the disparities and stuff like that overseas, and I really, really wanted to understand where the U.S. healthcare system sat at that issue. And definitely, like, looking into this fellowship, I learned more about insurance and how medical debt is carried on, and people are fighting medical debt for the rest of their lives, and so it like weighs such a heavy barrier on their like credit scores or whether they can afford groceries for the month. And I definitely think this was an eye-opening experience. Also, learning about insurance and just medical debt as someone who is like kind of gearing up for their adult life was definitely interesting, and I had so many takeaways from like the sessions that we had where we had people come in and talk to us. And I am hopefully going to use all this information as a possible physician in the future. I want to pass it over to Victoria.
Hi everyone, my name is Victoria Van Drost. I am a Master of Public Health student at SUNY Downstate, and my concentration is Health Policy and Management. So going into this internship, I feel like I talk a lot about medical debt a lot in my classes, but it's never humanized the way that it was within this fellowship. So I think that's something that I will take with me throughout my professional career, but also how to communicate and fell on page. And how to communicate about like something as complex as medical debt, and I guess using different language when we talk about it, again, to reinforce that humanity within medical debt. And it's been great working with everyone. And I will pass it to Eamon.
Hi, my name is Eamon. I was born and raised in the Bronx, New York, and I went to Stony Brook University out in Stony Brook, Long Island for undergrad, where I majored in psychology on the pre-med track. And I would say the biggest takeaway I've had from this program is someone that came into the program not knowing much about medical debt, but wanting to be well versed in it because I am someone who wants to become a physician in the future. And so this program gave us a lot of resources and information, as well as connections with very influential, knowledgeable people that are well familiar with medical debt, to be able to enhance my knowledge and give me the appropriate resources to know, to be aware of how medical debt is perpetuated and how it can be addressed. And so I think that with what I've gained from this program, I can attempt to reduce medical debt for youth and other people, my peers and other people in my community, erase medical debt and to be able to afford healthcare at a higher frequency. Thank you.
Hi everyone, my name is Ariana Small and I am a student at the University of Buffalo. I'm currently studying public health on a pre-medical track, and I am passionate about medicine, healthcare, and public health. During my time with Undue Medical Debt, one thing that really stuck with me was just how widespread and devastating medical debt really is, even for people who have insurance. Working on the research side helped me see that the real human stories that are behind the statistics. What surprised me the most was learning how many young people, including college students, are already impacted by medical debt, whether that's through personal bills or family struggles. It's an issue that touches all communities, even if we don't always talk about it. Because of this experience, I feel a strong responsibility to share what I've learned with my peers and my community, to spark more conversations about financial health and advocate for better protections against medical debt. So I think raising awareness around medical debt is critical for young people. It's not just a future problem because it's happening right now. So by understanding it early, we can push for a more compassionate and fair healthcare system. Thank you so much to Undue Medical Debt for such an incredible experience. I learned so much. Thank you for your time.